CPT 90837 psychotherapy billing has one trap. A 53-minute session you can't prove gets downcoded to 90834, and you lose money on every visit. Underdocumented sessions that default to the shorter code are the single most common source of revenue leakage in therapy billing. CPT 90837, individual psychotherapy, 53 minutes or longer. Here is the complete reimbursement and billing guide for operators and billers. We cover the code definition, Medicare and commercial rates, place of service, modifier rules, and the documentation that protects the claim. CPT 90837 is the code for individual psychotherapy lasting 53 minutes or longer. The standard 60-minute session. It is the highest volume, highest value individual therapy code. Most outpatient programs generate the majority of their therapy revenue from it. Its shorter siblings are 90834 for 38 to 52 minutes, and 90832 for 16 to 37 minutes. The time you document decides which code you bill. When a 90837 session lacks clear time documentation, payers downcode it to 90834, and the gap is real money on every visit. Medicare's illustrative midpoint runs about $150 for 90837 versus roughly $107 for 90834. A per-session loss that compounds across your caseload. Payers increasingly use missing time documentation as the basis for downcoding 90837 to 90834. Thin notes are grounds for denial or post-payment audit. A generic EHR won't tell you a note fails the 90837 time threshold. Behave Health's platform is designed to connect session time to the code billed. Automated time tracking is designed to link session duration to the correct CPT code and flag documentation that does not meet the threshold for the code billed. Surfacing the gap before submission is how programs stop the slow 90837 to 90834 revenue leak. 4 factors decide what you actually collect on a 90837 claim and whether it holds up at submission and at audit. Miss any one, and you risk a downcode, a denial, or an underpayment. Let us walk through all 4. Requirement 1. Document the session time. The note must clearly support the 53-minute minimum that distinguishes 90837 from 90834. Time documentation gaps are the leading reason payers downcode 90837. Every therapy note must support the code billed. Requirement 2. Use the correct place of service. In an office setting, place of service 11, the non-facility rate is higher because the practice bears the overhead. In a hospital outpatient or residential setting, the professional fee is lower because Medicare assumes the facility bills overhead separately. Requirement 3. Apply the right modifiers. Telehealth sessions need modifier 95 or GT. Most payers now reimburse behavioral health telehealth at parity, but the modifier is required to avoid denials. Use modifier 59 when billing distinct same-day services, such as individual and family therapy together. Requirement 4. Support medical necessity in the note. Notes should show ongoing functional impairment, risk, and active treatment goals, not routine maintenance-level therapy for a stable patient. Therapy goals and interventions must align with the treatment plan and the diagnosis on the claim, or the claim is exposed on audit. Rates vary by payer, locality, and contract. These are illustrative ranges. Verify yours before relying on them. Medicare's illustrative national range runs about $125 to $175 on a work RVU near 2.10. Commercial payers typically reimburse 120 to 200% of Medicare, roughly $180 to $300. Medicaid usually pays the lowest, often about 60 to 80% of the Medicare rate, and varies widely by state. Your 90837 rate as a percentage of Medicare tells you in one number whether a payer is paying you above or below market. If your 90837 rate falls below about 120% of the Medicare midpoint for your locality, that contract is a candidate for renegotiation. Operators commonly request around 160% of the 2026 fee schedule for 90837, consistent with the in-network market range. Behave Health connects clinical documentation to billing, so the elements that make a 90837 claim defensible are captured as the work happens. The platform is designed to link session time to the code and flag notes that do not meet the 90837 threshold before they are billed. Modifier logic for telehealth, place of service, and provider credential is designed to auto-apply, reducing a leading cause of therapy denials. Variance detection compares allowed amounts against contracted rates and is designed to surface underpayment for follow-up. Stop losing 9837 revenue to downcodes and underpayment. Book a 20-minute demo at behavehealth.com. See time tracking, modifier logic, and variance detection built for behavioral health billing at behavehealth.com.